Hello, everyone. Thank you so much for inviting me. Thanks to Global Genes and Parvati. I'm Archana Panda, and I represent Cure SMA Foundation of India. I'm the co-founder, director, patient advocacy, and I'm based in Gurgaon, which is near Delhi, in the northern part of India. I'm here to share a journey of Cure SMA India, and of course, it's a long journey, but I have 10 minutes, 10 to 12 minutes to share with you. So I'll quickly jump into the presentation. Basically, it is we call our journey as chasing unthinkable because we are in a country, a developing country where we don't have, things are not affordable and accessible here. So that's why we call it as unthinkable. That we are what we are trying to do here. So again, to start with, I'm really glad to share that we have partnered with CureSMA US. Again, CureSMA US is the kind of a parent organization for us because it is it is them where we got inspired and we started the journey in India in 2014. So basically, we started with a small group of parents and especially mothers, and we started with the Facebook page, and from there to a WhatsApp group, and then we realized that we have to register ourselves as an organization, and so that's how we established ourselves in 2018, and of course now we are a legal entity and we follow and registered with Government of India. We follow all the compliance that are applicable to any NGO in India. As of now, we have more than 650 plus SMA patients from across the country, and all types of SMA, 1, 2, 3, 4, and of course we represent all, the entire community from all walks of life and all region and all languages. And our vision and mission is to dream of a SMA-free world and barrier-free and universal healthcare for all. And we believe in co-creating solution that is collaborating with stakeholders. You can, for more information, you may please visit our website, curesmindia.org, www.curesmindia.org, and we are very active on the social media, and you can visit at the rate Curiosum India. This is basically explaining length and breadth of the country, how we are spread. So we have patients right from the northern part of India, Kashmir, till the southern part, and from east and west. And this is the percentage, and type 2 happens to be the highest in amongst our registered patients. This is our patient onboarding system, wherein so based on a confirmed genetic test report with SMN1 deletion, this is how we onboard them. And then of course, initial part is the emotional, support, and telling them you're not alone in this journey, and then immediately trying to put the child, the newly diagnosed patient, to SMA protocol, whatever we have established till now here in India, and of course educating parents as much as possible, supporting them. And again, this is how we have divided the country into 5 parts: north, south, east, west, and central. And as I mentioned, it is led by mainly the mothers, and we divide, and we are supported by the state and city coordinators. So this is how we manage. Uh, Again, we are well connected with the external SMA community, right from US and the Europe, as well as South Asia Pacific country, as well as countries, as well as SAARC countries, which is the neighborhood of India. So we have formed a CureSMA SAARC group, which is again trying to support them as much as we can on building awareness and connecting them to some HCPs as much as we can. So our neighborhood, which is Pakistan, India, Pakistan, Bangladesh, and Nepal, Bhutan, Sri Lanka, those countries. Uh, for us as parents, what SMA means for us is basically it's like earlier it used to be a death sentence. If a child is born with the SMA, it is as good as you're born with a death sentence because there was no treatment. But slowly things are changing here in India as well, and we do have some medicines coming to India through some program or the other, and at least it is no more a death sentence. It is treatable disease, and we are trying our best to bring in the affordable treatment to India. Um, so again, we try to sensitize the stakeholders, especially the government and HCPs and pharma, to really intervene and help us, because we are running against time. Our children don't have time, and therefore we try to represent them in this form of a time bomb when we say that parents and patient are tied to the situation is like this, as if we are tied to a time bomb wherein it can explode anytime. We could lose a child, so therefore immediate intervention is required by the government and pharma and other stakeholders as well. And again, the type 2s are like slowly slipping from our hand, type 2 and 3. So this is how we try to represent type 1s who don't even see the first or second birthday, and type 2s who really live with a very, very challenging situation. They're confined to wheelchairs and they go through, scoliosis and low lung function and the threat of gastric reflux problem and aspiration pneumonia, deformities, and of course, progression with increased disabilities. Um, but these children are extremely brilliant and intellectually very sharp, and they're very good, achievers in performance. So we really believe that they deserve the best and the dignified life. These are some of our angels, the SMA patients who are no more with us. And you can see some parents who lost, and they say it's very difficult to move on after losing a child. We try to remember them every year, every time actually, but yes, we do hold this candle, for them in their memory every August. These are some of our achievers, children, SMA type 2s and 3s who are really good achievers. They are some of the national, toppers of some of the examinations, the board examinations in India. Some of them are writers and singers and whatnot, and all of them are big achievers despite all these challenges. So, with this situation in India, in 2017, we started understanding that SMA it requires a multidisciplinary approach. So again, we started with this multidisciplinary SMA clinic in the eastern part of India, and again, thanks to my colleague in eastern part of India in Kolkata, who started this in 2017 in one of the hospitals in India in eastern part of India. So from there, we have really come down, to a place where we have so many, SMA clinics running up length and breadth of the country, many cities now. In fact, today also we have two SMA clinics, in one in North Delhi and another in Kolkata. So, various cities now, and these are some of the pictures. So the idea is having, all specialties under one roof, so that patients don't have to, run from one city to the other. These are some of the pictures of the SMA clinics that we run. During COVID, we had to go virtual, and with the help of top clinicians from India, multidisciplinary clinicians, we published these guidelines for SMA during COVID and beyond. And we held a lot of virtual webinars on respiratory care and physiotherapy, etc. during COVID virtually. This is our outreach to the government, and you can see that we have really not left any door unknocked, and we have tried to approach the health ministry, the regulatory authorities, and all the government agencies in India. Uh, our work with the national rare disease policy, although SMA has been listed, but then we still have a far, long way to go, because the funding, the main root cause, is still to be properly addressed. Our other work with the government of India to bring in legal framework for compassionate use program in India, again with a lot of difficulties and a lot of challenges. Of course, it was not easy, but yes, finally we did succeed in bringing a legal framework for this in India. And this is again multi-stakeholder engagement with the pharma. You can see all the three: Biogen, Novartis, as well as Roche, and of course regulatory authority, and our HCPs. At India is a federal country, so we need to engage them at a central level as well as the state levels, and we have many states here, so across the length of the breadth of the country. So it's again reaching out to so many ministries, a big task, but we have to do this. So basically, we understood that we have to engage with stakeholders, convince them, sensitize them in order to bring up a solution. So this is how we engage with SCPs, the government, the state, and the central, and of course, the pharma companies as well. And we try to hold various programs with many stakeholders at state level, various state level. This is again the Spinraza program in India, the Nusinersen, which is given by directly, which is US-based NGO. So we had two phases already completed now, and the second phase just running even till the dosing is going on with some patients across the country. So the first phase had few children getting, and the second phase had little more children getting, and they have expanded from 4 cities to 13 hospitals now in various cities. So we requested them to expand this because it was not possible for travel, all from various parts of the country. So they were kind enough to expand this program in the second phase. These are some of the pictures where children have received this medicine. Um our journey with Roche, and starting from 2018 and till date, and now we have the first ever drug launched, approved and launched in India by Roche, thanks to them to bring this to India, despite knowing that we still do not have an insurance or a reimbursement model in India. But yes, we are all together trying to work on that. Again, engagement with Novartis. Uh, and again partnership with various other health related other agencies and other organizations, and holding some meetings with them, and programs with in the east, north, south, and international level program with them to spread awareness. And this is again a national level program where a national awardee person, Sudarshan Patnaik who is a renowned sand artist, he made this sand sculpture on one of the eastern part of India, very famous beach, and it's a very huge sculpture. And he did this for us, so to raise awareness on SMA, and this was covered by the national television with a panel discussion with one of the renowned genetists of India. So this was basically to create awareness at a national level, and again a national level, again a multidisciplinary national conference with the across the country top officials, and these are all the government authorities, the key stakeholders in healthcare, and across the country so many doctors participating in panel discussion. Then this is about internal members, and engaging them and telling them you don't have to always talk about SMA, but there's more, life is more beyond SMA for all of us, and especially children. So we try to engage them with a lot of other small competitions at painting, drawing, singing, and all that. And for caregivers, we try to motivate them, like smarter together. Together we can kind of webinars with them, and motivate them. And also this is a emotional and mental health level, health stress relief kind of a program, wherein we invite them and they can speak their mind, and especially talk about the pain, and also the social stigma that you can't speak about your problem to others. So those are the things that we address here. So this is internal stakeholder. Also, we hold a lot of awareness program for the parents, especially virtually now because all are at home, and during lockdown you can't go to outside for physiotherapy. So kind of trying to educate them on respiratory care, and alignment, posture, and braces and whatnot. Um, Again, multidisciplinary SMA clinics across the country. As I mentioned, we're expanding to many cities now. So these are some of the pictures, and you can see many good hospitals, renowned doctors are now part of this, and various cities you can see here. Again, our this year calendar, which is 2021, made with the drawings and paintings of the SMA warriors themselves, and this was well distributed with the HCPs and other stakeholders across the country. Trying to sensitize them, telling them, look, these children don't have the strength to hold pen, but still they're able to do this, and therefore they should help them. And again, social media, some of the celebrities reaching out to. So as much as we can, we try to do this again, race for seven participation and other programs with inviting other stakeholders. And this is a launch of Restiplam in India. Again, thanks to Roche for bringing this drug molecule to India. So this was on the 10th of July, very recently. And here now we're trying to work on two dual situations, like a short-term solution and a long-term solution. So till we get government intervention in terms of affordability, we are really looking forward for some crowdfunding, because otherwise we really can't wait. But the government will take time. But ultimately, unless we have government intervention, this cannot be sustainable. So therefore, we are trying to work with all stakeholders again. We have collaborated with some of the crowdfunding agencies to try and help individual patients as well as corpus. And again, this is just to try. And again, engagement with the health ministers of state and central, union health minister, as well as the state health ministers in various cities. There is a union health minister of India, Mr. Sri Mansukh Mandaviya, who is the honorable health minister of India. And again, with this help and representation, we have been able to successfully waive the taxes which are applicable to a molecule which has been launched in India. So when the tax are exempted, this becomes at least to some extent, a first step towards affordability. Basically, we still have a long way to go. And again, reaching out the state health ministry through using social media. Some of our warriors themselves have done this, and again going to public court of the government, some of the state level government, and reaching out to the health minister, and he assures that he may help. So again, we're trying to do all that we can, reaching out to government. And these are some of the other programs we've recently done in the Awareness Month, and again on orthotics and respiratory care and multidisciplinary approach. and physiotherapy and all that. And of course, we have renowned doctors participating in our awareness program. And we have done this on the Indian Academy of Pediatrician platform, wherein we have, we can reach out to all the pediatricians of the country. There are almost 32,000 registered pediatricians on this academy, and then we can reach out when we do this on their platform. We have invited some parents to talk about, because they have been successful in raising the through crowdfunding fund for Zolden SMA, which is 2.1 million USD, and they have been able to raise this the US prize money in India in Indian currency, and get purchase this medicine. So this is again something totally for the first time parents have done this. It's a very hard work, but we invited them to talk about what worked for them and what didn't, so that other parents also get some inspiration, if they want to raise money. So these are some of the programs that we do, try to engage with the external stakeholder, internal stakeholder, and yeah, try to, again, as I mentioned, trying to do something unthinkable for our country, building this ecosystem here in India for SMA. So again, thanks to you all. Thanks so much for the patient listening. And again, thanks to Group Jeans and Parvati.